Hello and welcome to our class. I am Dr. Carola Fortner and I am your instructor. And I want to just give you a brief introduction to the first week. This week the topics are the first 3 chapters of class, and we have early pioneers and mental health reform as our first discussion assignment, where you're supposed to pick out a couple of those pioneers and compare them and use like an outside source as well. So that should be no big problem. Obviously, as always, you have to post it by Thursday and then have your responses by Saturday. And the second assignment then is going to be the plus and minuses of evidence-based practice and manualized therapy. And that was sort of a thrilling topic for me because I realized, of course, that my doctoral advisor was Dr. Bruce Wampold at UW-Madison, who is the person on that question. And so he comes down on the idea that evidence-based practice is not really enough, but it's more what we really want is the common factors that are going into any kind of therapy. So all therapies can be useful and all therapies can be helpful. However, what he's saying is in this book, The Great Therapy Debate, let me show you this in Amazon. Here it is, The Great Psychotherapy Debate, the evidence for what makes psychotherapy work. And so what he's saying is that there are common factors, right? So evidence-based practice usually is what they do is they look at the specific different kind of factor of a certain therapy, how it relates to a certain clinical problem. And what Bruce Wampold says is that that's fine. There's nothing wrong with it. However, you have to have these other factors in there in order for that to work. So anything can work as long as I have these other factors, which is the common factor approach. And so he talks about the therapeutic relationship. And so those are like the alliance, the expectations, meaning that the client understands what the therapeutic process is and has an expectation of how it's going to work, and that aligns with their worldview, and also a lot of empathy expressed by the therapist. So those are some of these common factors of Bruce Wampold. And he actually cited something like 24 times in the book, and he is our good advisor here for our class. Now, the last assignment is local evidence-based training for PTSD and trauma. So the question there, or the ask is there, that you kind of familiarize yourself with some of the local resources in your community. So that's interesting too. So I'm liking this book, I have to tell you. I read it with a lot of interest. It seems familiar to me, obviously, but hopefully you'll find it interesting as well. And please let me know if you have any questions at all, and I wish you a successful first week.